So you had both the past and the future of UConn's presidents there. You have the present with Verna, of course, but she wasn't in on this talk. So Helen's the past president, I'm the president-elect for UConn's. And we both have quite a lot of experience of dealing with the COVID pandemic. Helen working as a nurse consultant in a clinic in clinics up in the northeast, and myself as a lead cancer nurse down in Reading. So we had different but similar experiences, and what that presentation was about looking at what happened during the first wave of the COVID pandemic, what our shared experiences were, and spoke about the fact that cancer services were basically for a while pretty much crippled by that, in as much that a lot of our nurses and a lot of doctors too got relocated to care for people in COVID wards in most trusts. So CNSs were moved sideways. Lots of our chemotherapy regimes were altered because we weren't sure what that would mean for our patients if they became unwell during COVID. So lots of changes. And that sort of contrasted, and it was the impact on patients and impact on staff. So there was that element, and then there was also contrasting that with what we're experiencing currently in the second wave of COVID, where we're basically running the same. We're running our normal services alongside a pandemic. So that's very, very different, and that has both good points in as much that our patients can be kept safe, but also it's challenging in terms of capacity and things like that. So there's two very different scenarios that we're working in, and we also sort of went through the effects of the personal effects of COVID, both on staff working in cancer, but also our patients, many of whom are elderly and were shielding and scared to come into hospitals. So, and also we looked at that about the positive sides of COVID, in as much that the use of technology and things like that, but also bearing a note, certainly myself, sort of wanting to sound a note of caution really about the massive sort of taking on of technology and talking to our patients in a sort of mediated way via telephones and video links and things like that is better than nothing. But is it something that nurses should be doing long term? Is it something that's proven by research to be a benefit? No one really knows. So we've done this as an emergency thing, but is it something we want to continue to do? So yeah, lots of interesting debate. I'm seeing the evaluations from the conference, and it was a well evaluated session. We were quite pleased with it. There's lots of questions. It was good. Yeah.